Good afternoon, and today I have a pleasure of interviewing my dear guest, Dr. Karen Parker Davidson, the specialist who will explain to us why it's so important to breathe through the nose. You know, this topic I raised on my channel multiple times. She's a registered nurse. She's clinical director of the remedy I call remedy intake, what help people to breathe through the nose, and she's author of two books, Breathe Through the Nose but Don't pay through this, and Decoding the Nose Decode. Good afternoon, doctor.
Hi, Dr. Maria. Thank you for having me. How are you?
And thank you very much to our audience. If you have trouble sleeping or sleep next to snoring partner, this program is going to be for you, because nose is the main hero of sleep and breathing problems. And if you're a medical professional who, just like us, trying to connect the dots, that's a very important dot right in the middle of your face. And as I described, Dr. Karen Parker Davidson, she's a big advocate of a nasal breathing. And this Sunday, she's going to be on Greater New York Dental Meeting presenting her lecture on importance of nasal breathing and how to accomplish it and how to measure that. She's going to bring a lot of toys, and people who have opportunity to meet with her there, you're going to get a lot of knowledge. And also she's going to talk in the connection with sleep disorder breathing. And through her life, she's in this field. She's in the medical field for 35 years, and she brought a lot of, knowledge to United States. And we're going to talk about that today. So please share with us, doctor, why this small reactive organ is being so underappreciated.
Yeah, it's really interesting because in all of my years, I've been in the ENT world since 2000. And, over that time, I was in the vendor status. So I worked for two ENT medical companies. So I was in the OR a lot, doing a lot of different cases in the offices. And over those 8 years, I saw over 8,000 ENT procedures in the office or in the operating room. And as I look back, when I brought over four-phase rhinomanometry, which is a device that we use to measure nasal flow and function, I was quite surprised as I looked back and thought, nobody's talking about this. So over the past 8 years, it has been my passion. I almost feel my calling to get this message out. And I'm only one of two global experts in the world in the development of this technology. Now, sadly, the inventor of four-phase rhinomanometry, Dr. Klaus Vaught, passed away on Sunday. And I'm going to try not to get emotional, but he was the inventor, my mentor, and my best friend. So I have a broken, heavy heart right now. But I will carry on his work, and it will be progressing over the years. And so when we look at the nose, I always say the nose knows. It truly does. It picks up so much. And that's why Klaus and I were talking one day, and Dr. Maurice Cottle, who founded the American Rhinology Society back in 1971, I believe. Dr. Maurice Cottle maneuver, if that sounds familiar, he and Dr. Vaught were very good friends. There was a rumor that was going around that there were 33 functions of the nose. So Klaus and I were on Zoom. He lived in Germany. We were on Zoom, and it was a year and a half ago, 2024 in the winter. I said, Dr. Vaught, there's a rumor that there's 33 functions of the nose. Do you think there's really more? And in his German stoic voice, he said, there's more. You know the nose better than I do. You tell me. So I went for a walk, and I just started talking to my phone, and I broke it down into parts: respiratory, social behavior, smelling, craniofacial growth, speech. And then I went down and broke down into more subsets. So I came up with 60 functions. What does that tell us? 60 functions. And then in the epilogue, I came up with 3 more. It tells us that without our nose, it is the survival pathway. And it's just not for breathing and smelling. It does more. And when you really break it down between neuroreceptors and chemoreceptors and mechanical receptors. And the first cranial nerve and the second cranial nerve, specifically for olfactory and smelling, goes right to the brain. So you can see how sensitive it is. Like if we smell gases, if we smell smoke, Thanksgiving's coming upon us, if we smell our favorite turkey and dressing and our favorite side recipes, it's really valuable. But it can also be our enemy in the way that nasal function is the nose's ability to do its job. Nasal resistance is the amount of effort it takes for the nose to do its job. So nasal resistance is our biomarker. That's what we measure. We measure the flow coming in the nose against a pressure gradient to see how much resistance is building up in the nose. Well, what does that mean? That biomarker and that amount of resistance is going to dictate our treatment options, our treatment progression, our treatment outcomes, and even the stability of what we're doing. Because believe it or not, we have 10 pressures in our head that really dictate our way to breathe. And I talked about this in a dental sleep medicine organization presentation. And I was only supposed to talk for 45 minutes, and we ended up talking for an hour and a half. And we have the most basic pressure, atmospheric pressure, that allows the air to come into our lungs. But we also have intrathoracic pressure, oral pressure, pharyngeal pressure, nasal pressure, intracranial pressure, all these different pressures that are really sensitive to how we breathe. And it's a domino effect. If one pressure is regulated, dysregulated, it's a domino effect. They all collapse. So I always say that dentists, they are actually no airway providers. What does that mean? Everything that they do affects the trigeminal nerve. And if you were to think of a spider, like a spider web on your face, it's like putting your hand on your face. This is the trigeminal nerve. It covers our entire face. That's that main nerve. But we have a few hitchhikers. The vagus nerve, we have the hypoglossal nerve, and the hypoglossal nerve is controlling the tongue, the vagus nerve is controlling our sympathetic versus sympathetic rest, digest, or hyperactiveness. And anything that the dentists do to help patients sleep better is affected by the trigeminal stimulation. So you can see it's impactful.
Absolutely.
And so it goes across allergy. If you have a stuffy nose and you have allergies, you see an allergist. If you have a deviated septum, see an ENT to fix it. If you have a vaulted palate, which is the floor of the nose, you'll see an orthodontist or a dentist to expand and bring it down. If you have anxiety, depression from congestion, well, you'll see a psychiatrist. If your child can't sleep and they're hyperactive and have an airway problem and can't breathe, they can be misdiagnosed with ADHD. So you see a psychologist. So this little tiny organ, I call it a diagnostic organ, because it's wrapped around so many specialties. And that it's really intriguing.
Absolutely. It's such a great story. So I want to talk about resistance and talk about the intake, the device, what you are, clinical director, and you educate about intake. I know you have intake next to you, and I use intake in my practice all the time to help people to sleep better. I recommend them to use the intake. Can you talk a little bit? What's so special about intake? People say, oh, I use the breath strip, but I said, no. The intake, it's totally different story. So tell us what's so different in intake, different from breathing strips.
So what's really unique is that when you look at nasal dilators, there's been a long history. Like in the 90s, it was the Breathe Right strip. Then there's like Air Max. Then there's nasal cones. And there's, the Rhinomed, the Pronto, the Butte, the kind you put in the nose. And I came in contact with intake a few years ago. And I've done the research. I've measured it with rhinomanometry. I use it in my office when I still see patients. Here's what's really fabulous about it. I'm going to show you. So there's these small tabs, and you put them on the side of the nose. But what I want people to do first, because there's two ways to do this. We do the coddle maneuver. That's the internal nasal valve. Then we have the external nasal valves that are right here in the nostrils. So what do? How do we test? Do the Davidson maneuver, named after me. You take your index finger, just lift up the tip just a little bit. And breathe your nose and see if that feels better. Now, I'm an external nasal dilator girl. And what's nice is that the trial pack comes in 4 sizes. So it's nice you can see what's best for you. But here's the trick. A bigger nose, a wider nose, and this goes back to a presentation in 1973 at a rhinology meeting. A bigger nose does not mean better function. Why? Because we have natural resistance. If someone tells you to breathe with no resistance, they're lying to you. We have just enough resistance. Everybody has their own level that's good for them because it varies by age, gender, race. There's so many different variables that affect this resistance. Think of it like Goldilocks. Not too much, not too little, but just right. So when you use the intake, what we do, there's 4 different sizes. There's the S2, which I use a lot on my ladies, the M2 and the M1, which a lot of my guys will use, adolescents. And then there's an L1. When I use an L1 on most of my professionals, it's like basketball players are almost 7 feet tall. But it comes in 3 different colors, black, white, and clear. I have a clear. And actually, home office made me a little cheetah. I love animal prints. So they made me a cheetah bear. But when you put this on, test here. And when you put this on, the difference is it provides a certain amount of tension on the nasal walls. Well, why does that matter? When you breathe in, now, when everybody breathes in real fast like this, all of your nose will always collapse. Why? Because the increase of negative pressure causes the wall to collapse. But you can have a natural nasal valve collapse. And so when you put this on, you should see your nostrils stay and not really move. Well, why do that? Because it allows consistent amount of air to come into the nose. And as you breathe through your nose, the inflammation from the turbinates usually drops, lets more airflow come in. The brain senses, hey, I can breathe good. I'm not in fight or flight. I'm relaxed. I'm getting good oxygen, good sleep, good executive function, and everything is calm. And that resistance is high, or even obstruction. And we can have many types of obstructions. We have what we call hypertrophy, swelling of the turbinate. You can have what we call pomposis, which is a polyp in the nose. You have a deviated septum. So again, the intake provides a consistent amount of pressure. It's almost like a brace. When I work in plastics and ENT in the device world, we used to sell what's called a Denver splint. And we use it for rhinoplasties or nose surgeries, nose jobs. And this almost and I told the owner, I said, this reminds me of the Denver splint. It's like a little cast, to keep the nose from flaring in and out. But what you want to do is you want to make sure you have the right size for you. How we do that is we take it, we hold it up to our nose. This is called the alar. It's called the alar width. From here to here is called the alar width. And you hold it up under your nose like this to make sure it's the right fit for you. And then just pop it on. If you have a deviated septum, let's say I have a deviated septum to the left, what I'm going to do is put it just a little crooked and pick up that side
That's a great tip.
a little bit more So the smaller nostril, you can pick it up to say more and give it more attention to almost make it even. You want your nostrils to be even, right? And symmetrical. So it's a really great tool because some people don't want to have surgery right away, and that's okay. So how do I use it in my office? When I see patients, I always do my facial analysis and posture check. It's called Maverick. And it tells me, I look for the eyes, the nose, and the jawline and the ears. Is one lower than the other? Is there asymmetry in the jaw? That tells me a lot from their breathing patterns from the past. And then I'll do rhinomanometry, a baseline, to see how much resistance. And usually with Maverick, I will tell you, I have a paper written up, but Maverick has been 100% correct in identifying nasal resistance. So what I see in someone's face is usually what I see in rhinomanometry. Isn't that neat?
Yes.
So I will do what's called a nasal provocation test. And nasal provocation test under the guidance and recommendation of the American Academy of Asthma, Allergy, and Immunology. Their practice guide, is that you spray and you wait 10 minutes, not 5, not 15, but 10 minutes. And then you'll do another rhinomanometry measurement. So in my office, I will clear spray. It's homeopathic.
Mm-hmm.
Do rhinomanometry alone. You don't want to have your patients use a spray 8 hours, at least 8 hours before they come into your office.
Mm-hmm.
And you don't want to use a Flonase or Alprin. You don't want a medication in there because that can artificially simulate a situation that may or may not be there, right? We want the most natural environment when we're testing. Mm-hmm. And this is what we're going to be talking about in New York in the lab and introducing rhinomanometry. So once I see that there's a huge change between the baseline and the nasal provocation test, that tells me there's a lot of soft tissue issues. And then I ask about allergies, food, or exposure to mold. On the East Coast, we've had a lot of hurricanes, a lot of flooding, a lot of water in the houses. And if you have mold, that can cause respiratory problems as well. And I also ask about medications. I have 5 pages of medications, supplements, and herbs that have a side effect of nasal congestion. So think about that. A lot of your sleep apnea patients have high blood pressure, beta blockers, metoprolol, I call them the laws of beta, LOL. All the drugs are beta blockers and LOL. And I remembered in nurse practitioner school, the laws of beta. So a lot of your beta blockers that you use for hypertension for sleep apnea patients has a side effect of nasal congestion. Well, patients that take NSAIDs, ibuprofen, that has a side effect of nasal congestion. So we really have to take a deeper dive. So intake is a great adjunct. I send the patients home for 2 weeks, clear spray and intake for 2 weeks. Come back to my office. Let's remeasure, reevaluate your nasal resistance. That's the biomarker, the inspiratory resistance. Let's see if your inflammation is down. Once I can see a change, then I refer out. So I have a little group. I call them my posse. I have an orthodontist. I have a physical therapist, several ENTs, psychiatrists, psychologists, craniosacral therapists. I have a group that I will send the patients to. And then after they start treatment, I have them come back a month later and reevaluate that resistance because I want to see, is the treatment working? Do we need to tweak it? Now, again, this is good. You can use it with an oral appliance.
That's what I do in my office, yeah.
Yeah. You can use it with an oral appliance. If you can use it when you're getting expansion, CPAP machines. We don't want a lot of air going into the nose on CPAP. And what's interesting is that patients with high nasal resistance will say that their CPAP just isn't working. Well, why is that? Remember, the nose is detecting the velocity of air, the amount of air, and the temperature. 85% of CPAP air comes through the nose. Think about that. Positive pressure going up to negative pressure, and the worlds collide. And the patients aren't very compliant because they're so uncomfortable. They feel claustrophobic, or this isn't working for me. So I tell my sleep doctors, hey, if you can drop their pressures from 12 and 13 down to 5 to 6 centimeters of water, more air can come in nicely. It's not so drastic. You put your intake on, and everyone's happy.
Yeah.
So you can see how diverse this is. And I really feel like it's not a one-stop shop per se. But intake, and I use it in athletes. My son's a college baseball player, and he uses it during workouts for recovery, in the weight room, and when he's warming up. More oxygen uptake, more oxygen intake, better muscle recovery, less dehydration, and muscle use, muscles getting tired. So it's really a great tool.
Yes.
And we can use this in the industry. We can use this in children as young as 5 years old. That's the industry standard. If you look at like all those different dilators, they will say children 5 years and up. But because we have the little tabs that go on the nose with the little magnets, I always tell the parents, just be cautious and check on your little ones and make sure that they know, don't put those in the mouth. But that's the only thing that I worry about. And for my pregnant ladies, if you think you're going to get pregnant or are trying to get pregnant, I always like them to prepare their body. And how do we do that? Good breathing and good sleep. And even then, when the hormones fluctuate during pregnancy, especially from the second trimester into the third trimester, your heart rate variability, which is looking at your heart and how it's beating, the heart rate variability will drop drastically. The hormones go up, congestion goes up, and your heart rate variability goes down. And I was working with an MLB baseball team, and I was working with the trainers, and I was looking at all of the heart rate variability tracings. And I said, got a cold, he was sick. And the trainer said, how do you know that? Because when the heart rate variability drops, I know the nose is not working.
That's fantastic information. So we appreciate you share so much, and I hope it's going to be so valuable for our audience who can't sleep, but also for medical professionals. And I hope they can see you on a Greater New York to learn this, basic but such a necessary health information. And I want to mention you can find information about Dr. Karen Parker Davidson on her website, and also she has 2 books about the nose decoding, and breathe through your nose, don't pay for this, how nose really affecting whole health, and intake, that wonderful invention what can help kids
I love
during
it.
the pregnancy, people who do sport, and regular people who have congestions from whatever reason. That's a really revolutionary tool. So thank you very much.
Yeah, I wanted to share that the second book, The Nose Decoded, Unveiling the 60 Functions That Impact Your Health, that's still in formatting, so hopefully it will be out next month. I will have my own website, KarenParkerDavidson.com. That will hopefully be released. I'm going to give it the first week of December. I'm also just an account on Substack. So it's at Dr. KPD. So KPD is one of my EMTs gave me a nickname. So Dr. DRKPD will be my Substack name. Also on Instagram at _ the nose, so NOSE, KNOWS. And just phone me, email me. I'm happy to answer questions. Now, if you're a medical provider, a dental provider, as the clinical director over at Intake and the educator, I have a special site for you to try Intake, and I highly recommend it. So it's KPD, that's Karen Parker Davidson, KPD.intakepartners.com. Go to the website, put in your shipping information. You will get a sample, and then Derek will call you and just give you a chat and do more training with you. It's a great little system they have set up. So those are a lot of ways to get to me, and I'm always open to collaborate. And even if you Google me, you'll see old podcast guests that I did, lectures I've done, and even some of my papers I've published. Yeah.
Fantastic. Thank you very much. And we're looking forward to learn more about the nose. Thank you.
Thank you. Like I always say,